You've been treating a patient with Temporomandibular Joint Disorder, or TMD, and both of you are frustrated with the limited improvement in their jaw and facial pain, as well as their overall jaw function. We need to analyze the care they are receiving, identify any gaps, and assess how it's all being applied. First, let's set the tone. If someone isn't improving, it's crucial not to put the blame on the person receiving the care. Instead, we need to approach the situation with some curiosity and problem solving. Let's review some of the key areas that can impact outcomes. The treatment itself. Are we addressing the right areas? TMD isn't about just the jaw. It often involves the neck, the spine, and even how the body moves as a whole. Are the techniques appropriate? Soft tissue work, joint mobilizations, cranial symmetry, and proprioceptive exercises are all tools we can use, but they must be tailored to that individual. Are we being mindful of pressure and recovery? Overly aggressive treatments can cause setbacks, even if they feel effective in the moment. Are we understanding the person's mental emotional state and stress levels? Looking at this from a biopsychosocial model is helpful. Home care matters. Oh my gosh, home care is a game changer, but only if it's the right kind and done consistently. This includes stretches, postural exercises, and even lifestyle adjustments like food choices. Without compliance, progress can kind of stall out on us. Life beyond the appointment. Sometimes life throws a wrench in recovery. Maybe they felt better right after the treatment and just overdid it. They moved furniture, they helped their buddy move, worked at a desk for hours, dealt with stress that they just didn't know was coming. These things can influence how our body responds to treatment. The body's adaptation process. Here's an important insight. Change, even positive change, can be uncomfortable. For example, improving your jaw mechanics might cause your neck or your back to start having issues. The tissues and the muscles need to adapt. This is part of the healing process and can open the door to more lasting improvements. Pain isn't always about the physical tissues. The nervous system plays a huge role, especially in chronic or persistent cases. Central sensitization, where the nervous system becomes overly sensitive, can cause widespread pain even after jaw mechanics are addressed. Collaboration is key. Are we working with a team? Sometimes TMD treatment requires input from other professionals. Massage therapists or physiotherapists for manual therapy and home care guidance is the first step. NUCA chiropractors for upper cervical alignment. When it's needed, it's really needed. Psychologists or counselors for managing stress, home stress, work stress, pain stress. Doctors for pain management or medication. This needs to be closely monitored for them. Dentists for mouth guards or orthodontics. Permanent changes to the teeth are a drastic step and need to be considered whether you're going to do it or not. What we as therapists need to ask ourselves, do we fully understand the assessment and diagnosis? Have we communicated this to our patient, and are they an active participant? Are we using the right tools and skills? Are we adapting the treatment plan to the individual's needs? Is the frequency of treatment sufficient? Giving hope in extreme pain. For those in severe pain, our approach must be both gentle and confident. Show them there's a path forward. Hope is a powerful part of recovery, especially when we can see the solutions ahead. The bottom line, TMD treatment isn't a one-size-fits-all. It's not a cookie-cutter recipe. It's about understanding, adapting, and collaborating. Whether you're a therapist or someone seeking care, remember, progress is possible when we take a holistic, patient-centered approach. What approach has your therapist used? I'd love to hear your thoughts and experiences. Has your needs been addressed, or were you left wanting more and didn't feel you were heard? If you want a little bit more info on the temporomandibular joint, check out this playlist.